Okay, let's make a start then. So just to say hello to everybody, thank you so much for joining us today. My name's Beth Elliott and I'm from the Lloyds Register Foundation, and I'm going to be moderating today's panel session. So today we're going to be talking about the continued prevalence of work-related accidents and injuries around the world, and what needs to be done to make sure we can see improvements both in relation to physical safety, but also with regards to mental well-being, and how all of this ties in with the ESG conversation that's happening in so many parts of the world right now. So we'll be taking questions from the audience towards the end of the webinar, so the last 15 minutes. So please do send your questions in using the Q&A functionality, and we will get through as many of those as possible towards the end of today's session. So firstly, I'd like to welcome today's panelists. So I'm delighted to be joined today by Dr. Sarah Cumbers, Evidence and Insight Centre Director at Lloyds Register Foundation, which is a global charity with a mission to make the world a safer place. Also Kathy Seabrook, founder of Global Solutions and an ambassador for the Capitals Coalition, a global collaboration transforming the way we make decisions. We're also joined by Jim Harter, Chief Scientist of Workplace and Wellbeing at Gallup, and James Pomeroy, Group Health, Safety, Environment and Security Director at Lloyds Register. So thank you all for joining us today and welcome. But before we move to the panel for our conversation, I'd like to start by asking Sarah to talk through some statistics around occupational health and safety around the world to set the scene for today's conversation. So I'll now share the presentation and it's over to Sarah.
Lovely, thank you very much, Beth. So as Beth said, we're a charity, the Lloyds Register Foundation, with a mission to make the world a safer place. And we do this through funding a range of different programmes, focusing on education, innovation and research, all with safety outcomes at their core. And so the next slide just gives you some key facts about the World Risk Poll, which is one of our major programmes, first undertaken in 2019, conducted by Gallup. The World Risk Poll is a global poll and surveyed in 2019 over 150,000 people in 142 countries across the world. So across different demographic groups, and really giving a voice to people who haven't had the opportunity to speak up about safety and risk issues that they face for the first time. And Gallup polled in regions that are frequently excluded from comparative polls. And so one of the reasons that the World Risk Poll dataset is really important is because of the breadth of the research, and it provides us a very accurate picture of global attitudes towards risk and safety than has ever been achieved before. And so today, although we polled across a range of issues, I'm going to focus on the data that we generated on workplace safety. And so this next slide just illustrates the results from the most ambitious question that the poll asked. This was an open question that asked all 150,000 participants about the safety risk that was top of their mind. So what's the biggest source of risk to your safety in your daily life was the question that we asked. And you can see at the top there at 16%, the most commonly cited risk was from traffic, with crime and violence coming in a close second at 12%, closely followed by health-related concerns. But of relevance to today's discussion, highlighted there in red, 2% of respondents cited work-related accidents as their most present risk. And that relates to millions of people across the world reporting that the environment in which they work poses the greatest threat to their safety. So on to the next slide, and that links into another question that we asked just of workers this time in the poll, and whether these workers had ever been seriously injured while working. And a staggering 19% of respondents said that they had, and that translates to nearly 600 million people. And so this data gives us a really good understanding of the demographics of these workers who are not being protected by current health and safety systems, or when these simply fail to exist, and gives us a real opportunity to improve the safety of these communities. And you can see here on the map, this illustration where the colours are lighter. This shows that, sorry, the darker colours show us that these workers who've experienced significant risk of harm live disproportionately in Africa and in Asia and in lower and middle income economies. So the highlight there, the staggering 69% of workers in Sierra Leone who reported a serious injury at some point in their working lives. So notably, low-income and middle-income regions tend to track fewer statistics on occupational injuries, but workers in low-income economies were more than twice as likely at 31% as those in high-income countries at 15% to say they've been seriously injured while working. And these findings are largely in line with the latest official statistics from the limited data that was available before the World Risk Poll on non-fatal occupational accidents. So more than 50% of the workers in 7 countries told us that they've been seriously injured at work at some point. And these countries all in Central or Western Africa, Eastern Africa and Southern Asia. And it's within these countries that agriculture is the largest employment sector. And so this slide here shows us the injury rates by sector and occupation. And you can see that workers in the agriculture sector are at more significant risk of injury while working than in other professions. However, construction and manufacturing also sees a high risk of injury, and there are several regions in the world where workers in construction and manufacturing are significantly more likely to be injured than those working in agriculture, and these include North America, Central Asia and Southern Europe. And so on to the next slide, please, Beth. And within the poll, we asked about 5 specific common workplace risks. So we asked whether people had ever experienced risk from these 5 sources of injury: tripping and falling, operating equipment, violence and harassment, fire and chemical exposure. And we also asked about their perception of those risks as well, whether they thought they might be likely to experience harm from those risks in the future. And having that data set of perception and experience gives us a really valuable snapshot to really understand how closely people's fear about risk matches the actual likelihood of harm, and to then start to look at the characteristics of individuals where those factors may differ, and really help to start to pinpoint safety interventions that can make a difference within these communities. And so on to the next slide, which shows that the top perceived risks varied by region. And the key takeaway here is that this variability means that therefore our action on workplace harm should also be tailored. So with strategies and interventions that are tailored to local need and context. And just to pick out, for example, you can see that Northern and Western Europe, the top risk to safety, the perceived risk, was from violence and harassment in the workplace at 23%. So on to the next slide. So we know through a lot of previous research that's been done that positive organisational culture, where employees are really empowered to report unsafe situations and behaviours, benefit the employee and employers alike. These cultures enhance the safety of workers and can also have benefits to the company in terms of reduced insurance premiums and limits on exposures to things like fines and lawsuits, and reduced leave taken when individuals are injured on the job. So one of the questions that we asked in 2019 was designed to give us a global measure of the empowerment of individuals to report unsafe situations and behaviours. So we asked workers whether they felt that they could report safety issues without fear or punishment. And we found that the overwhelming majority, at 80%, felt they could. And no one region fell below 60%, which suggests that actually globally, the building blocks for those for positive organisational culture that has an impact on safety are fairly strong. However, we can also then use the poll data to pinpoint countries where work is required. And only 2 out of 142 countries surveyed registered figures lower than 60%, and those were Senegal at 55% and Pakistan at 44%, indicating a real opportunity here for organisations to further grow their existing safety culture foundations by implementing risk reduction programmes. And this data also showed us that economically vulnerable groups in society are least likely to feel that they can speak up and are at greatest risk of unsafe working practices. So also that data showed us a correlation between people's ability to speak up and laws and codes that protect individuals in the workplace. So perhaps not surprisingly, workers in countries with weaker safety systems or few regulatory protections were less likely to say that they felt free to report safety problems to their employers without fear or punishment. So on to the next slide, please, Beth, because we also then asked workers whether they felt that safety rules at work are a good thing. And you can see here that we identified perception of safety regulation as a really strong leading indicator of safety. So this slide shows that workers who felt that safety rules make their job more difficult to do were about twice as likely to be injured at work than those who see safety regulations as a good thing. So we need to do more work to understand and address the underlying causes here, but that gives us a really good indication of the kind of questions that can be asked of the workforce to really get an understanding of what's going to make a difference on safety outcomes. And then on to the next slide. We know that prevention of physical injuries has really been at the top of health and safety agendas in workplaces for quite some time. But we also know, and we see sort of increasingly discussions on this on a global scale, that psychological well-being is also vitally important, and that there is a link between physical and psychological safety. And so here we see that more attention needs to be paid to mental health and to look at these issues holistically, as we see a really strong relationship between injury at work and experience of mental health issues. So we don't know the direction of the relationship, but it's very clear that there is a link that really requires some further investigation and action. So you can see here that a worker who's experienced one of the 5 risks that we talked about previously is more than twice as likely to also report experience of mental health issues. So on to the next slide, and that's all on the 2019 data, which hopefully will have provided some stimulating stats and thinking for the discussion of the panel that will come. But I'm now going to take a quick look at what comes next for the poll. So we've got 4 cycles of polling planned. And one of the most important things to note about the 2019 poll is that it was undertaken in 2019 before the pandemic hit. And so we've got a really valuable baseline of how the world felt about and experienced this whole range of risks in our old normal. And we'll be following up a number of those questions that we asked in 2019, asking the same questions in 2021. So the poll's now in the field. We're going to be using those comparisons to really help us understand how communities have been changed by COVID, and also to understand where current vulnerabilities or resilience lie. We've also got 2 new modules with the poll this year. We're focusing in on resilience and also violence and harassment in the workplace. So just a final note on the poll, we haven't decided on the focus for 2023 and 2025 waves yet, and it will be very interesting to hear from the audience today about gaps in the global data set that you think we could use the World Risk Poll to address, and who we should be working on to use this data to make change. So just in conclusion, workplace health and safety is still a major issue globally, we all know that. But the World Risk Poll has really helped us shine a spotlight on the significant harm being experienced, particularly in low and middle income countries, and some issues persisting at significant levels, even in high income countries, for example, violence and harassment, even where strong regulation is in place. And so, as I said, I hope that the poll has set the context for our conversation today on how health and safety at work can be improved globally, and whether better reflection of health and safety elements when considering human capital could be part of that solution. Thank you very much.
Thank you, Sarah, and welcome to all our panellists once again. So it was obvious from those slides that this is still a big issue in many, if not all parts of the world, as shown by the World Risk Poll. And it's pretty obvious that we need to do more. So Kathy, can I come to you first to ask, and this is the big question, where do we want to get to? How do we get there? And what changes do we need to see?
Excellent question. And first of all, it's so good to really get the detail, some evidence from Lloyd's Register Foundation on what's really going on in the world. And really what Sarah depicted is differentiation between developed economies and developing economies, and how that's impacting work, perception of risk, and really looking at how the people are feeling, not just with their injuries, not just with thinking about the rules, right, the regulations in the workplace, but actually how does that transform their perspective on how they're looking at the future of their work, and their own personal decision making of where they're going to stay with the company or moving because they don't really have a choice. So with that, in answering and attempting to begin to answer your question, Beth, is to really be thinking about a complete transformation in the way we think about people. So, you know, when we talk about human capital, we're talking about the skills, the knowledge, the capabilities of people, and what value that actually brings to an organization, that concept of a human, a person working in an organization. And what we're trying to do, and I call it the true north test, and you'll hear me talk about this any place anyone will listen, and that's where the impact and the actual dependencies of people and their health, their safety, and their well-being are all taken into consideration and valued in the true capitalist perspective, because that value is actually reflected in business decision-making, as well as ultimately performance. And I know Jim Harter is going to talk a little bit about that correlation between health, well-being, and performance. But this really is the premise. And we are at early days. We have a long way to go. There are a confluence of activities that are happening. So in 2020, the investment community in the United States, around the world, is saying, you know, companies need to be on purpose. They need to have a purpose. And it's no longer the purpose of a company to just have creating value for their shareholders, but that's exploding out. That's looking at all of their stakeholders. So stakeholders now, and stakeholder primacy is looking at the investors. What value is a company creating for their investors, for communities, for the customers that they have, for their supply chains? And one of the areas that's really coming out, which is what we're talking about today, is the people in their organization. And you can't talk about people unless you talk about their health, their safety, and their well-being. And as the World Risk Poll identified, this concept of mental health is coming into the foray. And for those of us that are actually safety professionals and health professionals in this world, we're coming to really understand this global recognition, specifically through some of the ISO standards that have codified. Even though they're voluntary consensus standards, there are 160 countries around the world that are saying mental health is a risk, is a business risk, and needs to be managed within the safety and health management system. So you can kind of see, for big picture on down, that things are starting to change. And wrapping this up, Kurt Lewin, who is a social psychologist who is known for change theory, he said, and this is change management is based on this, you got to unfreeze the current state. And right now, workers are costs. This is how all the stakeholders are seeing it. But what's starting to transform, and frankly, it's the investment community that's pushing this, is that workers actually create value. And what are the impacts to a company and the dependencies a company has on their people? And we just saw this through COVID, and we're starting out the other side. So there'll be more opportunities to do a little bit deeper dive, but those are some of the things that are coming to play. And the investment community and the standards that are being set are really pushing us in that direction. But again, we are early days.
Mm-hmm. Okay, that's great. Thank you, Kathy. It was interesting, that conversation around the value of human capital. Now, you mentioned standards which are voluntary. So James, I'm going to come to you now. Can we rely on voluntary action for businesses to do this, or do we need more regulation? Are legal interventions required to make this happen?
When we look back at the history of safety over, say, the last 50 years, since the development of the OSHA Act and the Health and Safety at Work Act and the various kind of other instigations from a legal perspective, they've been transformative. They've really made changes, and we don't often give credit to regulatory interventions. When we think about some of the challenges that we're facing in developed countries, they are issues that have fallen out of our memory. 500,000 people in Africa are suspected of being exposed to silicosis. That's an industrial disease that actually in the West, unless you're in the mining industry, we're not that familiar with anymore. Current cases of exposure to asbestos. Now, the challenge with these big mega risks from a voluntary point of view is it creates a competitive disadvantage for one organization to go ahead of another. So regulation has a key role to play. In fact, when we look back at reductions in fatal and serious injury, it's actually regulation alongside technology that has played probably the biggest element in terms of reducing those numbers of injuries down. However, regulation is a very blunt instrument. It's very blunt, it's very broad, and it is also dependent upon a regulatory system being in place. And Sarah talked about some of those challenges. So voluntary systems have a role to play. The challenge with voluntary systems is that they are very much developed around large economies and large organizations. They really don't touch small organizations, and almost all people are employed within an SME sector. So that's our challenge.
Yeah, thank you, James. Sarah mentioned in her presentation that physical safety is high up on the boardroom agenda, but what about mental well-being? How important is that to the board at the moment? So Jim, I'm going to come to you because I know you've got a lot of experience in this. So what's your view on what needs to be done, or what is being done, to make sure employees are fully engaged and their mental well-being is being looked out for?
Yeah, that's a good question. If you go to our website, gallup.com, you can download a report that we just published on the state of the global workplace. And we look at well-being across the globe. And yeah, we were able to conduct a global poll during the pandemic. A couple things. One is we see spikes in worry, stress, sadness, anger, which are precursors to burnout. We've seen a slight drop in engagement, although employee engagement has been on the rise for the last decade. So that's encouraging. And we know how to improve employee engagement. And the elements that go into that. A couple of things from a CEO perspective that I think are really important to be thinking about. This newer workforce, even before COVID, was asking for a workplace that would improve their well-being. So it's a criteria for people when they're picking where they work. Now, this might vary a bit depending on how developed the countries are that workers are in, but that work-life blend is something that employees are very well aware of and know that they can do something about in terms of how they select employers going forward. A couple of reasons that CEOs I think are more and more interested in well-being right now. One is attracting star employees. What happens inside organizations goes outside organizations very quickly, and it will even more so going forward. That'll be a really important trend to be watching. And also, of course, safety, performance, and resilience have a lot to do with what happens inside organizations and the cultures that organizations build, and how they think about not just engaging employees, but also how they think about coaching them and helping them improve their overall lives. So those trends I was speaking of a little bit ago that have dropped this past year, or increases in negative emotions, are changeable and fixable. For instance, 20% of workers globally are engaged. The best practice organizations we've studied are at 73% on average. So, and they've done some very purposeful things to get there. And so I'm encouraged that we can do some things about this. I guess one final point would be that I think it's really important that we pair really good subjective measures with the objective measures, because it tells us a lot about what's going on inside organizations and precursors to future safety incident issues through the attentiveness and vigilance that employees bring to work every day. And so I think regulations paired with the subjective side of things is really important.
Oh, thank you. Thank you, Jim. I just want to pick up on something that James mentioned about when we were talking about standards, that it gives large organizations a competitive advantage potentially. Are you seeing a difference, Jim, in terms of how much organizations are tackling well-being issues in terms of the size of the organization? Are large companies doing it better?
We have seen companies of all sizes, actually, and they start really the place to start is with employee engagement, and to make sure you have that measurement right and everything around it right, meaning that to engage workers, you got to pay attention to what they need to do their work. You put them in the right roles. Give them a chance to do what they do best. When they do something well, recognize them. These are simple things that get overlooked. Listen, a big safety one is just listening to employees and making sure, Sarah brought this up earlier, making sure their opinions count at work. These are all factors that can be influenced regardless of the organization's size. And our database includes really large multinational organizations and also small startups and very small organizations. And they're all working on some of these same issues. That engagement piece is foundational to building trust, where you can then go to the next level and start influencing people's lives.
I think, Beth, from my point of view, I think what Jim has talked about there, I think is probably the biggest challenge that we face for ESG and safety. Because at the moment, the dialogue is all around metrics and reporting. And they're important. They provide a sense of transparency. They provide information for investors and employees to understand. But what Jim talked about in terms of that subjective element about getting an opinion, I think is really critical. And we've seen over the past year and a half the importance of listening to the voice of employees. So marrying up objective data and some of the challenges around doing that, perhaps we'll come on to, alongside some element of subjectivity, I think is really the key to tell the numbers alongside the narrative.
Yeah, very, very good point. And sticking with the topic of data and information, we know that the human element is increasingly recognised as critical for a business, and it's central to long-term resilience. So how, Sarah, I'm going to come to you now. How can more data and information help us with that?
Yeah, thanks, Beth. And I think, again, COVID can actually help us here, because what the pandemic has done is really encourage businesses to seek a really greater connection with their workforce in a way that hasn't been seen previously. For example, tracking wellbeing in employee engagement surveys. But what we've also seen during the pandemic is businesses trying different approaches to improve wellbeing. And, not only high-performing organisations who have then pivoted to do something different, but also organisations who haven't thought about psychological wellbeing previously, starting to to come and take it seriously and take some action. And so what the foundation has recognised is that actually the last year provides us with a real opportunity with a range of interventions that have been tested through COVID that we want to be able to learn from. And so we've actually commissioned some work from Nottingham University, Nottingham Business School, to formally capture and accelerate that learning into practice in the future. So their role is to connect with organisations globally, to understand their experience and to try and then systematically capture this evidence so that we can learn from it. And given what we know about that strong link between well-being in the workplace and safety, we should really be viewing these steps to improve psychological well-being as leading indicators of safety. And I'm really interested in understanding how instruments like the World Risk Poll can be used to provide essentially a global benchmark for leading indicators that then can help to promote use of appropriate metrics that really can help to drive improvements in safety outcomes. So making sure that actually we're measuring something that really is valuable and is telling us something that we need to know.
Thank you. So we've talked about indicators, metrics. So what exactly should organisations be reporting on? And is there a need for something to be globally standardised here for consistency? So Kathy, perhaps you could pick up on that. Oh, Kathy, you're on mute.
Trying to be mindful of my colleagues. Thank you. So we have to look at this as an ecosystem, if you will, systemically. We're talking about metrics, we're talking about government regulations, we're talking about the market forces that are coming together. And there's not any one thing in particular by itself that is going to be making a change from worker as a cost to worker as actually creating value. The forces at play are standards and standardization. So one of the things that is happening is corporates, organizations are saying there's too many reporting mechanisms. We're getting all these questionnaires and worksheets for ESG investing, which is environmental governance and social investors. They want information, they want transparency, but they're getting like 15, 20, 25 reporting forms and questionnaires, and they just, I mean, that's all they're doing. They're not actually manufacturing their product or providing their service. So one of the things that has just happened recently this month is the International Integrated Reporting Council and the Sustainability Accounting Standards Board have come together. Now SASB, the Sustainability Accounting Standards Board, is proving to be one of the leaders. It's Global Reporting Initiative and SASB that have come out with globally recognized standards. GRI more globally, the gold standard for companies in the reporting on their ESG, sustainability disclosure. And I guess at the Capitals Coalition, we're looking at reporting as one aspect, because as we know, what gets measured gets done, and what gets reported has to be measured. And so that takes us backward to what is it that are our key performance indicators? What is it that we're actually going to disclose? And what we're saying at the Capitals Coalition is we want to switch to value. So we don't want to just look at, okay, these are the KPIs that are lagging. So in our world, these of the safety and health, the incidents, the ill health, their mental health cases, claims for compensation for workers around injuries and ill health. What we're saying is companies need to map out their own impact pathway. They need to be looking at an injury or ill health, and how does that actually impact the business? So impacting the business is, yes, that employee is out of work. Their skills, their knowledge, their abilities, their attributes can no longer contribute to the thriving business. So there is the person themselves, and then there's also the impact that person has on the business. And that's the value creation, right? And we're looking at the negative. What we want to do is go upstream and say, okay, let's look at the impact pathway. And the impact pathway says that employee working in this organization actually creates value by their skills, by their knowledge, by their innovation, by their ability to get the work done in a timely manner, but also the dependencies. So the dependencies on that employee being healthy, mentally and physically, impacts healthcare costs. It impacts the communities in which they work. It impacts the reputation of the company. And I know Jim's going to talk at some point on the concept of caring, because Gallup has done some really good work in that particular area. So as he's also talked about, well-being, which all ties together. So this concept of value ties in, again, dependencies to the hiring, retention, promotability, the diversity, equity, inclusion of people, and how they are career path, if you will, in an organization, and their loyalty to a company. And what is the value of that? And we haven't cracked that nut, but that value, once we get there, and we'll get there slowly but surely, how does that impact the decision-making on a daily basis by a foreman, by a supervisor, by an investor, by anyone within this whole ecosystem, if you will, to make a decision for the safety, health, and well-being of that person.
Jim, following on from Kathy's comments, I'll come to you to talk about value, talk about caring, talk about well-being. I know, as Kathy said, you've done a lot of work in this space. Perhaps you could talk us through some of that work, but also how included are those elements in the ESG dialogue at the moment? Is it missing, or are you seeing people looking at this in more detail?
I think we really need standards when it comes to what I've been calling subjective measures. We need objective measures of subjectivity, I guess you could say, and we don't have to start from scratch. Gallup has spent decades studying those subjective elements that lead to all kinds of outcomes, including safety incidents. And so we've got big databases we can leverage, and we're committed to providing those measures to the public, to organizations, and building databases for them. So that's a service we're willing to provide. We've conducted stakeholder interviews on the topic of ESG, conducted literature review, construct review of which constructs seem to be most relevant, reviewed our own databases, conducted reliability and validity analyses. We've got a technical report can send anybody that's interested. And we've conducted meta-analyses of these concepts and how they link to various outcomes. So we've got a starting place, which is 5 items. Our goal at Gallup is always to find the simplest way to measure the most things. So we look for items that capture a lot of information, but that employees everywhere can understand and respond to. Again, those 5 are available to the public. They're not proprietary. We're committed to helping organizations measure these. And the topics are really around ethics and compliance, an item that links to whether people actually report something when they see it. DEI, which an item on respect, which links to discrimination and harassment. Reports on the negative end of it. On the positive end of it links to engagement. Employee development. We've got an item on well-being. It's a real simple one, but it captures a lot. It's whether people feel their organization cares about their overall well-being. And an environment item on how people perceive their organization is serving people and the planet. And so generally, I guess the thesis around all this is what happens inside organization usually is known by employees first. And we need that perspective from people who are in the action every day, and that needs to be paired up with some of the other measures that we're talking about. It hasn't been real well formulated yet, but I think it can be pretty quickly. And I think the goal is not to try to develop this perfect subjective measure, but to take what we know currently and pull it together as a starting place. And then we can add on top of that. But these items I just mentioned are basics. They're available. You can go to our website and find them, or get a hold of me, and I'll send you all the materials we have on them. But I think it's a good starting place, and we can build on top of that going into the future. Our meta-analysis on safety includes about almost 11,000 business units around the globe. And we've looked at outcomes like lost work time, workers' comp claims, number of incidents, incident rates. To give you some perspective, top quartile business units have 64% lower safety incidents in comparison to bottom quartile business units on employee engagement. So just that concept of engagement is really important in organizations, and doesn't explain all of safety, but it explains a sizable amount. And I think it's because of the fact that what happens inside organizations tends to predict some of those objective outcomes.
Thank you, Jim. There's a lot of food for thought there. I just want to stick with the ESG question, if we can. So, James, I know you've got some very strong views on this. Can we talk? What's your view on how ESG can be used to tackle these problems that we're still seeing around the world? Is it fit for purpose? Is it working?
I think ESG is a trend, is a movement, and we can't deny that. You know, it is certainly something that organizations, boards are talking much more about and rethinking what their social purpose is. And the pandemic has really helped us think about that a lot more. The challenge for ESG is the fact that at the moment, the whole dialogue is about metrics. It's all about getting more data. Now, if anybody thinks that actually safety outcomes are going to be improved by just getting more people to be more transparent and report, I think they may be in for a surprise. The challenge that we face is that we need more localized approaches, more nuanced approaches to ESG. We need to actually focus much more beyond reporting to actually define what is good practice. And even within the metrics, if you think about some of the metrics that have been talked about so far, all of them are yesterday's news. And we know within the safety profession that things like lost time accidents are actually telling you very little. So we need to, and they're actually telling you the absence of safety, not the presence. So fundamentally, we need to look at what we're reporting and then try and move the discussion on beyond actually solely thinking about metrics and reporting. At a more profound level, we need more localized approaches to ESG. I'm not 100% convinced that a global standard is going to work, because the challenges that the mining industry face in Southeast Asia and Africa are very different from from what we face in the West. And a lot of the discussion about mental health, for example, can be seen in the context that many of the physical hazards in the West have been exported and diminished. So therefore, there's a bigger debate to be had about actually whether we are having the same language and talking the same issues that the developing world thinks of in terms of ESG. And we may find that it's much more geographic, it's more sectorial in its approach. So I guess if I summarize all of that, we need ESG to be more localized, we need to move beyond data and reporting, and we need to create a pull factor that actually says, what is it that actually from a voluntary perspective, an organization would go above and beyond legal standards, beyond just reporting from what an investor requires, to actually do something meaningful in terms of reducing injuries, ill health, and improving well-being.
Yeah, thank you. Did anybody else want to add to that, to James's comments, in terms of their views?
I would just build on that because I absolutely agree with James. Again, we talk about this ecosystem, if you will, and there's so many motivations and incentives that are starting to come into play. And initially it was like report, report, report. And that is not the answer. I totally am aligned with that. It's really tied to, again, going back to value. It's tied, and those are all externalities, if you will. So reporting and thinking about legal compliance and thinking about those voluntary standards that are out there that companies are embracing and reporting on. It really has, if there's going to be sustainable change over time, there has to be a transition in thinking by companies and organizations to start to really, again, I keep coming back to value, start to think about what is the value of their people. Again, no longer workers at cost. You can furlough them during COVID. You can, reductions in staff, reducing benefits and that kind of thing. No longer that thought process primarily, but to really be thinking about those impacts that the company has on their people, the people have on their company, and really starting to think about what those pathways are and taking those externalities and creating them as internalities, and that companies and organizations start to really embrace this bigger picture of what their people actually mean to them. And if there was any time in at least in this near time in this century, COVID, if COVID has not driven that home for companies, those are probably the companies that are not going to exist longer term. In the shorter term, they are existing. But I just want to give an example, and then I'll get to the last question. But recently, I don't know if any of you have read what's going on with Apple. 80 employees, and this kind of ties all of us together. 80 employees basically said, we want to continue working remotely. And this is something that is across the board and around the world. These questions are being asked, but these 80 employees, they didn't come and say in their letter to Tim Cook, who's the CEO of Apple, that we're not going to work. They said, we want you to hear our voice, because there was this statements that were said that, oh, we know that you really want to come back to work and everybody's, can't wait to do that. And they were saying, no, actually, we are having a work-life balance now. We have time with our families. We're not spending 2 hours a day in our total commute back and forth to work. We actually have a sense of our health. We have a sense of our well-being. And so those 80 employees were saying that we want you to hear us. We want you to be thinking about, and this to me are the metrics. If we want to talk about what we're going to measure, we want you to actually have a question in your exit interviews of people that are leaving Apple, so you can better understand, is it about remote work or not? We want you to have, your climate, your engagement surveys, have some questions around that so they can actually gather data. Because what this group said was, we have been more productive than ever by working remotely. Why should we change? So this is this concept as worker, as employee, as a stakeholder. And this is the value creation that, I keep trying to hammer home, but this is playing out in real time. Now we'll see. Those employees didn't say we're going to quit. what they said was, we want you to hear our voice, and we want you to understand how we can better provide value, if you will, a contribution to Apple. So Bloomberg commissioned, it's called Morning Consult, and they found that 40% of the people that were interviewed, and this I think was primarily in the United States, that there was like 40% that said they would absolutely leave their job if the company said there would be no more remote work. So again, right? Stakeholders, workers, employees as stakeholders. So these are some of the trends that are starting to happen. And, you know, this is early days, so watch the space.
You know, I imagine that's a conversation that's happening in a lot of organizations right now, that whole,
Yes.
as some companies are encouraging, I use that word lightly, employees to go back into the workplace. We're seeing lots of news stories about how different organizations are tackling it.
I think, Beth, just to build on that, I think the big thing we just need to kind of pinch ourselves and remind, and just as a sense of reality, ESG is a conversation that's happening in large global organizations, but the vast majority of people are employed in SMEs. So we know we're getting somewhere with this when it actually happens in the mum and pup shops, the small little operations, the people employing 15 people or less. That's when we'll get somewhere. But at the moment, it's these very large corporates that are talking about it. And so the journey that Kathy talks about is the journey geographically, but most importantly, demographically, into these much smaller organizations.
And economically as well. Yeah. And really you speak, it's so important because it's got to start somewhere. And what's happening now, and this is part of ESG, this is part of the expectation of the stakeholders, is the supply chain. And many of these small, medium-sized enterprises are part of supply chains around the world. And so the expectations longer term, hopefully, and the investors are asking the questions about what are you doing in your supply chain. Nike, for example, at a for the Capitals Coalition, we had it was a workshop, and we had it at L'Oreal. They graciously, Malk Staves, reach out to you, thank you, had a workshop where we got together, and the gentleman who's head of the global supply chain for Nike basically talked about the investors were asking Nike. And so he got up in front of the investors in the investor call to talk about their supply chain. So these kinds of motivations and incentives, companies are really starting to think of. So James is spot on, but it's got to start somewhere. And it really is starting with the large multinationals, but we will not be there until it gets down to the small, medium-sized enterprises.
Good news is a lot. I'm sorry.
Go on,
ahead.
Jim. No, carry on.
I was going to say the good news is a lot of the concepts that actually predict a great work culture and performance are the same, regardless of size of organization. They're generalizable, kind of think about it as human nature and leveraging human nature inside a workforce. The concepts of role clarity, recognition when people do good work, getting people in a job where they can do what they do best, development. Everybody's looking for development regardless of the size of the organization. Number one reason people changed jobs pre-COVID was career development. And unfortunately, inside organizations, people weren't getting that. And so they'd go outside to get the career development. You're seeing that now with some of the ESG, or pardon me, some of the trends as a result of COVID that everybody's been talking about here, where people are looking now. We found 48% of people are at least looking for opportunities out there. So there's been kind of an awakening that organizations are going to need to really understand. And I think the key to getting that right, though, is we've got to upskill managers so they know how to coach people effectively, and not just assume that they can put a blanket kind of set of policies out there where they handle everybody the same way. So much of what drives engagement and well-being is situational and individual. Managers are the only ones in position to really know those situations and be able to accommodate those individual situations people are in.
Can I also come in, Beth, just linking back, Kathy, with your point on externalities, and just to highlight a piece of work the Foundation's doing at the moment to really understand how safety is valued at the moment and the methodologies that are used in practice to help organisations determine whether to make an investment in a safety intervention. And our understanding at the moment is that is mainly based on a financial calculation, money in, money out. And actually, Kathy, I think there's a huge amount that we can do to generalise the factors that should now be taken into account, because we're aware of a far broader range of value that's important to bring into these calculations: environment, sustainability, but also social factors that would include well-being of workers, etc. And so we're just on the first step of that. We're working closely with Capitals Coalition and other organisations to take that work forward. But ultimately, we want to arrive at a position where there's new guidance available to organisations, probably starting off with large corporates. It's inevitable that that's, you know, the sort of the top of the tree, but ultimately wanting to influence all businesses so that they can make a more holistic assessment of the value that safety interventions are going to bring.
Thank you all.